Okay. Can you hear me? I can't hear you. Can you hear me?
Yeah, I can hear you now.
Okay.
But I'm saying you now. I did it from the
Okay, there's
who's that?
Toby. Here's Karen Cox, Haymaker.
Monday, Tuesday, Thursday, and Friday from 8 a.m. to 5:30 p.m.
Is that Toby?
Yeah, I think what has to happen is I have to be the moderator.
Okay. And I'm you.
Are you still me?
Yeah.
Oh, yeah, I see. Well, but Toby's not.
What?
Toby has his own name. Joan, how did you?
I don't know. I signed up under my name too. I'm gonna leave again.
You just keep leaving. Hey, Karen, we can't hear you or see you. Toby, you're muted. That's okay. Karen doesn't want us to see her face, but she also doesn't want us to hear her. There's Karen.
Hi.
Hey, where's your face?
You can't see me?
No.
I don't know. I don't know how to do anything.
Well,
I'm here.
Okay. There's Cammie. She just joined. Hey, Cammie. I can't hear her yet. Karen, did you turn your video on?
I was pushing buttons, so I don't know if it's on or not. It has recording up here. I've not done this before.
Yeah, well, that's okay. We're there's Cammie.
Hi.
Hi.
I'm still you, Dawn.
Oh, well, just be me then. That's fine.
Okay.
It's Katerina, my little one.
Yeah, we're gonna have some kids.
It's a dental meeting.
I'm gonna go outside for a bit.
Ted needs to try again.
In the nice heat, Cammie?
Yeah. Hi, baby. Hi, baby.
Toby, can you text Ted the code that you used?
I sent him the email. I just sent him the email.
Yeah, but maybe he's trying to check in as me also.
We're all Dawn. We're all Dawn.
There's going to be a whole bunch of Dawns. So Toby got in using what I sent. So that's why I was hoping that Ted could get on too. But that's okay. We have 8 minutes until we start we have 23 people signed up.
Great.
Yes, that's good.
Woohoo.
And so once we get going, what I'll do is I'll mute me so that Joan, you can take over.
Okay.
And then I'll just be here listening to y'all. We'll get all the kinks worked out.
So what about the other people?
If I
here?
don't get if I don't get a break for my kids, I may have to mute.
Oh, we have a new member here.
How do you know that? Oh, the cat?
Yeah.
I saw it sitting on your shoulder last night.
This is the other one. You want to
Okay,
be on this thing?
where's Ted?
Ted. Let's see. Where's my phone?
Okay, there's somebody.
Is that Ted?
No.
It's Dawn.
I know. It's going to be multiples of me all over the place. We should have 6 people on. We have Eva Gupta. Oh, there's Ted.
Hey.
Finally. And I can see your whole face.
Wow, we did it.
Yeah.
Hey, but I'm Dawn. Look, I'm Dawn.
You look really good, Dawn.
You
Dawn,
dyed
you
your
look
hair.
really good too, Dawn.
Yeah. I always said I wanted to clone myself. Look at that.
Wow, this looks great.
Okay, now we got Teresa on in the car. Hi.
Hey, Teresa.
Hi.
Hey.
Well, this
How
is
are
pretty
you?
cool. We're learning.
Hi.
Last night we had a trial run, and thank God we did, because we wouldn't have been able to do what we're doing now, which
Zoom
is,
is actually a pretty cool thing. When we were in Jamaica, 3 of my team members were in Houston, and the rest of us were in Jamaica, and we had very long meetings, you know, all on Zoom, and it turned out really, really well. Like everybody was on their phone kind of thing. It worked out really well.
We have a new member.
Hi, Kitty.
okay, well, let me see. We have 8 people on, and we still have 5 minutes. So, do you want to do the screen share?
Come on.
And I think I can still manage the participants as they come on.
Okay.
Ted, you look bored.
I'm just thinking I'm in my kitchen right now, and I'm thinking I'm going to have to move this whole thing into another room, because when the kids come back, it's going to get noisy here.
Yeah. Well, we just have Lindsay Holman that joined. So now we're up to 9. Pretty cool.
Hi, Lindsay.
I can see a picture, but there we
There
go.
you go.
I'm on a meeting. I'm on a meeting. I'm on a meeting.
Oh, happy birthday.
I'm on a meeting, Mom. Happy birthday. Did you get your presents? Awesome.
On mute, eh?
Good, I'm good.
Okay, Joan, can you take over the screen? And what I'll ask everybody else to do is mute their whatever function, the mute function on there. And then if you need to talk, you can come in and unmute yourself. But that way, we'll let Joan and take over the meeting.
Nope, some more people.
Yep.
Okay.
Oh, can you see it on your screen too, the managed participants?
Yeah, Candida.
Okay.
I just see Candida. Just came on.
Okay.
When you do manage, or it just says participants.
Yes.
Hi, Cammie.
Okay, so I'm muting myself.
I'm
Hi,
muting myself.
Teresa. Happy birthday. Oh, not yet. That's this weekend. The big 5-0.
This weekend?
This weekend.
Oh, you're a baby. So, should we start?
Sure.
Well, welcome to the Mentorship Mindshare. Welcome, everyone. So I guess we're going to have everyone mute, I guess, except for Ted. Ted, you can stay on. And we'll give a little overview about how both of us got into biological dentistry, and then if y'all have any questions afterwards, you'll feel free to ask them. I have a little helper here. So I started it was about 22 years ago, I guess. I had a boyfriend who had cancer, so I started looking into alternative therapies. And at the same time, there was he was actually an ophthalmologist in town who was doing chelation therapy. And he took me to lunch and started talking about mercury and how horrible it was. And he gave me actually the gigantic poster framed of the meridians from the Academy of Biological Dentistry. So I was like, whoa, that was like my first real big introduction. So I went, this is before the internet, of course. So I went there and looked at the number, and it was Dawn. And I called Dawn and they said, we have a meeting in a couple of months. So I went to the meeting, and there I learned not only about mercury, but fluoride and root canals and all the other goodies, cavitations and all the other nice components of biological dentistry. And just I started doing it in my practice. I first started not doing the mercury. Then we started taking it out safely. I got rid of the fluoride pretty much right away. The root canals took me a little longer because I used to do a lot of endo. And then I was thoroughly convinced after a short while, and just was a little concerned economically about how I would cover that cost. But I realized I could make that up taking out the mercury safely. So that wasn't a big deal. And I've been doing it ever since. And I kind of just ease the patients into it. I actually just bought the practice next door, which is a conventional dentist practice. So I'm having to kind of ease those patients into what I do because they don't know much about biological dentistry. So the hygienist stayed with that practice. Like I pretty much we used the Nada paste. We just took all the fluoride out of the prophies. And I used essential oil, so they pick which flavor they want for their prophy. So I've already switched that hygienist over to that. And I'm kind of easing them in. Like one patient needs a mercury filling replaced, and I told them, this stuff's toxic, so we're gonna do it safely. So I kind of introducing it that way to them. I don't want to freak these patients out, but I'm slowly introducing it to them. Ted, how do you want to talk? How did you?
I guess my story is just a little bit different. I wound up being that guy who wound up with that mercury problem. I started out by having, I guess after dental school, you have all your dental work done in dental school, and then you can get a bunch of years out of it before you got to get it attended to. So it was at the time where those things started to fail, and a majority of them, a lot of mercury, a little bit of gold, whatever they needed to sign off for the approval to get through dental school, we had it done. And so when it started to fail, I looked around for a little while to see if I couldn't find a doctor who I hadn't seen a lot of mess ups on. So I found somebody who was relatively competent. And I had him basically rip out all my mercury. And shortly thereafter, I wound up, I guess some of the symptoms that we typically find in mercury patients, spontaneous weird rashes, wild mood swings, a little bit of depression here and there. And my wife was the one who was very astute. She said, Ted, I think you got mercury poisoning. And I said, I don't think so. Yeah, it's just mercury. It's no big deal. And I said, I'll prove it to you. I'll go to my doctor and I'll have all my tests done. And so sure enough, I went to the regular doctor. The regular doctor looked at me, checked everything out, said, you're fine. I think she's a little worried. Maybe she needs a little Prozac or something. No big deal. It didn't go over well. So about a couple of months, not even a couple of months, maybe about a month later, she comes back to me and says, hey, Ted, I'd like you to see a different kind of doctor. And so she said, I'm like, okay, honey, makes you happy. I'll go wherever you want me to go. So this guy was a holistic practitioner down here in Miami, the name of Martin Dayton. He's written a couple books. I don't know that he's still practicing anymore, but he's a really wonderful guy. I walked into his office. He looked me in the eye. I looked him in the eye, and he says, you're mercury toxic. And I said, you're freaking crazy. He said, no, calm down, calm down. You're a dentist. I said, yes, I am. You deal in mercury. I said, well, back in 98, I stopped putting it in because the Florida Dental Association sent me a letter that said, if you tell your patients mercury is poisonous, we'll pull your license. And so I said, well, you just told me this stuff is poisonous, whether you know it or not. So I stopped putting it in back then. What I didn't know back then was that there's a safe way of taking it out. And so when I was talking to him about it, I said, that's awesome. I'm so glad you don't put it in anymore. But you do take it out. I said, yes, I do. And what do you use for protection? Oh, my mask, my gloves and my vacuum. It's like, I'm sorry, that might not be enough to protect you or your patient. I'm starting to think about it now. It's like, well, what's he talking? So it's the vapors. Vapors. Yeah, when you hit that thing with that high speed, the vapors go everywhere and you have the pleasure of breathing it in. And I'm starting to think to myself, is it, maybe he's got something. And then the next thing he says, well, look, I will test you. I can tell you you're mercury toxic because the other thing is, by the way, you're in my office. You don't come to my office if you're healthy. So we did the test, and sure enough, I was mercury toxic, and that changed my world. That was really, I got real angry. I got very angry at the American Dental Association, and then I said, well, hold on, I'm going to question everything that they did and said. And then I found out about fluoride, how wonderful that was not. And, then the root canals, like you, John, it came later, okay? A gentleman by the name of Steve Green, he is a holistic dentist. He's the only one in the town, and everybody thought he was crazy. But he was the first guy I called once I got my diagnosis. And he says, you got to go here, you got to go there, you got to do this, you got to do that. And I said, okay. So I signed up and joined and started going. And that's where it really started to hit home. And after my first meeting, it was the IAOMT, actually, the first meeting. And I came home for that meeting and I said to my staff, everything's going to change. And they looked at me as if I was crazy. And I did it slowly. I think the first thing I bought was a gas mask. And then I bought the vapor traps. And then little by little, I'd add a little bit more because my practice was totally traditional. And this guy is getting a little weird with his masks and his vapors and rubber bands and all this stuff and creams and on and on and on. So that's kind of how I evolved into it. But the root canals did take me a bit more because, like Joan, I did do a lot of root canals. And I was thinking I was doing the best root canal in town because I had myself a laser, okay? I was cleaning that sucker out, okay? But yeah, I finally gave those up too. There's just no good thing about it. So that's kind of how I got started. You want to say anything to that, or?
Well, the root canal, actually, the one thing that convinced me was my boyfriend who had colon cancer. He had a root canal in 19.
Oh, wow.
And that's when I was like, okay, there's something to this. So.
You want to open up the floor to everybody else? Do they have any questions at this point? Or is there stuff you want to say?
Do it, or you can, yeah.
Anybody else that wants to say something, unmute yourself and come on board. Candace, you got something to say?
Sorry, I'm late to, I'm just joining in. Sorry, I'm late to, I don't know what the question was.
Well, if you had any questions for us.
Okay, well, so I'm a pediatric dentist. Definitely trying to transition my practice. This just happened yesterday. So for pediatric patients, just wanting to know if you guys had any recommendations. And also, I remember Don and Teresa, you guys said there's some tablets you have them chew when you take x-rays.
All right.
Mindshare in the 101. I don't remember. But we had a parent yesterday who was adamant, no x-rays for a new patient. The kids were like 11, 8, and like 5, and have never seen a dentist yet. And but the dad was definitely told my front desk he will not have x-rays, he will not, no way, radiation. And she said he went on and on. And so I was like, oh, well, I'm having this class, I'll just ask, because I know you still take x-rays, right?
Yep.
I get a lot of those too.
So I guess first of all, especially as I'm transitioning more into this, that question is going to come up more and more. So if you have any verbiage or whatever those pills were, I know you guys said it. It's probably my notes from last year.
Can I interject or not?
Absolutely.
Okay, so the tablets are by Borean,
Okay.
and it's X-ray at 30C. You can get an account with them. We're actually going to have a class July 14th. It's a Friday. And we're
Okay.
going to do CPR in the morning and then office emergencies. And then we're going to have an entire afternoon of homeopathy for the beginner.
Okay.
And really focus on dental stuff. But if you get the Borean, you will make sure that they don't touch it. So you'll just open the little container and put 3 pellets in the lid and put them in a cup and just have them put them under their tongue. And the explanation I give them is in homeopathy, like cures like. And so we are trying to negate the negativity of the x-ray from today. So we're trying to erase it. I can't do that for every exposure that you have because you're exposed to radiation just going outside or flying on an airplane. But I can take care of today.
I have a liquid one. I have a liquid one from Des Bio that you do drops under the tongue. And I have them sign a release. If they don't want x-rays, I have them sign a huge release.
I have delta tocotrienol. There's lots of studies on PubMed that it's a form of vitamin E, and there's lots of studies on PubMed that show that it is it reverses the damage caused by ionizing radiation. So I've been giving every patient, when we take x-rays, I give them a little caplet of the delta tocotrienol, you know, and if they want to see the science, I direct them to the PubMed studies, because there's quite a few of them. And I give them the x-ray pellets. So between the two, we're able to, you know, to most of the time convince people. I have had patients who have said, nope, it's not happening. And my answer is, okay. In the state of Texas, it used to be, I think, a misdemeanor for a midwife to not put the goop on a baby's eyes, a newborn baby's eyes. And so they would tell the parents that they could refuse, but they'd tell the midwife that it was a felony misdemeanor, and that, you know, they could lose their license. And so when I am talking to my patients, I pretty much tell them the same thing. I'm like, okay, this is what it's done. It's put us in this position where, you know, they tell the patient they have the right to refuse, but then they tell the dentist that if we fail to take x-rays, then at that point we are guilty of supervised neglect. And I'm not willing to lose my license over this, is what it comes down to. So I'm willing to minimize the x-rays as much as possible. If all I can take are 2 bite wings, so be it, you know, and then a PA on any tooth that has a root canal. Then I'm, you know, that if that's all I can do, then that's all I can do. But I'm not going to put my license at risk over something where I can give them, you know, the delta tocotrienol and the x-ray homeopathic to help mitigate the damage, so that I can get the, you know, the x-rays that I need. And honestly, I'm in the process of trying to put together a book. So if any of y'all have x-rays that you can share and photos, what I'm trying to do is make a book that every dentist could use, like a coffee table book, showing how important it is to have the appropriate diagnostic photos, that we can't do it all with We can't do it all without x-rays. We need those in order to be able to diagnose decay. We need those to be able to diagnose periapical pathology. We need those
And
to be able to diagnose cavitation. So
I think if you just explain to a patient it's a necessary evil and that you minimize it, that's helpful.
Well, I just had a patient, I've seen him since he was 3. He's 21 now, and his mom's a midwife, and she kept refusing x-rays. And his brother hit him on 24, did a filling on it when he was 10. He showed up a few months ago, huge abscess, never had x-rays, and we lost 3 teeth. And she goes, how did that happen? I said, you never let me get x-rays, you know? So now I tell that story to the patients, and now they get them usually.
yeah, I'm just not willing to put my license at risk. So I take the x-rays if I need to. And, you know, I have had a few patients leave, and I'm sorry. And, you know, if you can't let me do my job, then I'm not the dentist for you. I'm trying very hard to do everything right.
Can you all 3 write that in, I guess, the Facebook page or I guess the liquid?
Oh yeah, I have to go look at it. I have to go look at it. It's at work. I'll send it to you.
Des Bio makes one called radiation.
Yeah, radiation free. Yeah.
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 Candace, I just wanted to say thank you very much for being here. I actually happen to have a situation where I do a lot of pediatric dentistry. A lot of the patients that I deal with are just like what you're dealing with. I refuse x-rays. If I don't know the patient, I will accept the idea that they had x-rays done before, and they will get them to me. And I will document that in the chart. Now, sometimes they get them to me, sometimes they don't. So I'm a little bit more lenient with that, in the sense that I'm trying to develop a relationship with the patient, and eventually I know I'm going to get my x-ray. May not be the first time out of the but eventually I'll be getting my x-ray. And I do explain to them. I actually have another story which might be helpful. I took over somebody's practice at one point because the gentleman refused to let any of his patients have any x-rays. Well, guess what? When I took over his patient population, I had hundreds of dead teeth. I was doing extractions like crazy. They lost teeth right and left. So yes, you do need the x-rays. I'm a little bit more lenient in the way in which I approach the patient because they got all this stuff in their head because they're just not well educated, all right? They don't understand that a little bit of radiation can solve or prevent a whole bunch of trouble. Now, the only other thing I've had little challenges with the pediatric dentists in my area is they love to do pulpotomies and stainless steel crowns. Now,
all the time.
I don't know what your stand is with that. I will go ahead and try to ozonate it too. I will try to sedate it. I'll try to do everything I can to possibly save that stuff. But I will not do a pulpotomy on the tooth. I actually have a wonderful little girl who came to my office. I think it was 2 weeks or 3 weeks after she had a pulpotomy and a stainless steel crown put on. By the way, a lot of times the dentists that we're dealing with here in Florida don't understand that stainless steel crowns actually have nickel in them, which is a known carcinogen. All right. So 3 weeks after she has this pulpotomy and a stainless steel crown on, and of course, needless to say, multiple bad experiences with the pediatric dentist, she loses all her hair. She is completely bald. And they come to me saying, hey, doc, is there something we can do? I said, yeah, that tooth's got to go. We actually happened to do a biopsy of that tooth, and the bacteria that were living in that sucker was just insane. I ought to post that one. So those are some of the little details that you might become more familiar with as you evolve. I don't know, does that help you at all with regards to the x-rays and the pulpotomies and stuff like that?
Yeah, I rarely do a pulpotomy. I lean more towards extraction or indirect pulp cap. The success rate is, but I mean, that's not from a biological, that I guess that's just more for
common sense stuff.
Yeah, usually if it's a pulpotomy,
It's bad. It's gonna fail anyway.
I think like in last year I did 8 pulpotomies the whole year. But my practice is also called Little White Tooth, and I try to keep everything white and not silver. But I also accept a lot of insurances, so that ends up, we have the stainless steel crowns available.
Okay. What I usually do in those situations is I'll do a giant buildup, and I'll call it such. So we're still not putting on the stainless steel. We're just a giant buildup. Yep,
Right.
it's 99.9% bonding. But you
Yeah,
know,
I do too.
in 5 years, we're good.
Yeah.
We do zirconia, the Easy Pedo crowns by Sprague. They work.
No,
really well.
I do zirconia. I use the same thing as Sprig, Teresa.
Yeah.
And so Ted and Joan, you've got some really, really new people in here, and then you've got some people that have been with us maybe for a year or so. What was the first thing that you felt like you had to buy equipment-wise?
Mask.
The mask
Yeah.
and Snuffy. I have Snuffy.
Yep, that was the
Dead
second
Airvac.
thing I bought. That was the second thing I bought.
And then Ted, I would love for you to share the story about what happened when we sent the vapor sniffer to your office.
All right. Well, I built my new office. This is going back about 6 or 7 years ago now. And I designed it to have exquisite ventilation. All the exhaust fans were going to blow all this mercury junk out the window. So I didn't, outside, so I didn't have to deal with it. And lo and behold, the sniffer shows up in my office. Now, what the sniffer is, it is a very, very accurate meter that tells you exactly how much mercury vapor you have floating around in your office. And so, well, I turn it on and I check it out, and the meter is going crazy. And I said, that doesn't make any sense. And I called the guys who manufacture. I said, this thing's got to be broken. I said, no, it was just calibrated. You can test it by going outside and see what it was reading outside. So I went outside and I tested, it was reading 0. I was like, uh-oh, we got a problem here, Houston. So I went ahead and brought back into the office and started sniffing around, and the numbers were just insane. This is a brand new office. I was in the office about 2 years when I got the sniffer. It turns out I had somebody go up into the roof to find out what was going on. The piping that I had designed for all these wonderful vacuum systems were just venting it straight into the ceiling. So it was just basically recirculating everything. And so fortunately, I became aware of that, and we wound up poking a giant hole in the side of the wall, and now we can't read anything. I think we tested it after with a vapor sniffer, and it was coming out really good. So just so you might want to know, something to think about to ventilate outside if you can, and definitely get those sniffers, the trumpelopharies, whatever you want to call them, that suck up the vapors. Do you know what I'm talking about?
The ion generators?
No. This
Lumpy, the heffalump.
the heffalump.
Yeah.
I have God's ventilation. I have the front door and back door I can open, and the atriums.
That's great. That's good. All right, Dawn, do you have a picture of one of those things we could send her, or maybe we can post one on the web, what it looks like? Basically, it's a.
Are you asking about the Snuffleupagus to have a picture of it?
Yeah.
If you guys need something, if you will email me, I will take care of that. So my email address is just drdawn@drdawn.net. And whatever it is you need, I'll make it happen.
Thank you, Dawn.
Okay, any of you other attendees? I've got 13 people on here. Anybody have any questions?
Eva, do you have any questions?
Anything. It doesn't really matter what the topic. Well, let's stick to dentistry. I mean, this is your opportunity to really pick their brain.
Can you tell me more about ozone and what it does I guess you use it, you prep the tooth and then you use the ozone. I've heard about the ozone, but I guess if you can explain that more. Because that seems like for my practice, maybe like that would be one step to go towards.
Well, that's very helpful. You want to go, Joan?
Doesn't matter. I use ozone for everything. Especially for the kids. I tell the kids it's unicorn farts. Because it's stinky. But I always use it in a syringe so they don't get too much. But yeah, before you put if you put a crown on, before you do the filling, I use ozonated water in the lines.
So it's the water or it's air?
It's water. For surgery, you can ozonate water. So you can actually put it in your lines to keep the biofilm down. And so when you're drilling, it's ozonated water.
Okay.
You can use the gas before you fill a filling, or after you do surgery, you bubble the gas in there to kill the bacteria. You could do it before you do indirect pulp cap. It would be really good to do that. Or even if you do a pulpotomy, you could ozonate. They put the gas in there because it's antibacterial, antiviral, antifungal.
So the goal is it's supposed to kill bacteria.
Yeah.
But it's also healing. Like for example, if you've got a decay close to the nerve, close to the pulp, and you're trying to get that tooth to respond, right? The ozone is oxygen, right? So it helps to heal that pulp. And sometimes a tooth that you're like, there is no way this thing is going to survive. You ozonate it, for a bit before you do the pulp cap and stuff. And sure enough, you will see on the x-ray several months later, you'll see the layer of reparative dentin. And it has really, really well and survived against all odds. And I have one where I was looking at the pulp, like it was just put the crown on him the other day, about 1.5 years, 2 years ago. I was looking at the pulp, and it was a very large class 5 lesion on tooth number 31. Enormous class 5. I was like, oh my gosh, there's no way that I'm going to be able to save this. He'd been to another dentist, and she had told him, she'd recommended a root canal. He came to see me, and I was like, look, dude, I don't know if I'm going to be able to save this, but I'm going to try. So I excavated the decay. I didn't even get all of it out because I knew that if I actually got into and removed all of it, that there was no chance for that tooth. So I excavated everything around the perimeter, made sure it was nice, clean dentin where it wasn't close to the pulp, and then I did a good 3 minutes of ozone insufflation gas right into like the entire prep area close to the pulp, etc. And then on top of that, I did silver nitrate to kill any potential anything. And then I put, a temporary filling in there. And I was like, all right, we're going to see if it's going to survive. I don't know if it's going to survive, but we'll see. And darned if, it didn't survive. I mean, obviously it survived. And so the other day I just did a crown on him on that tooth, and he's doing great. And this is a tooth that I was absolutely certain was not going to survive, and it did. So that's the healing power of ozone.
Yeah, that's what's great. You can also inject it right into an abscess too.
Oh, and you can put it in kids' ears. You can inject their tonsils.
Yeah.
We do so much in pediatric dentistry. And we really need to have another ozone course for the staff, because it's one thing for you guys to learn how to use it, but if your staff is the one that's going to be making it. They're going to be filling the oxygen tanks. It's not going to be you. So once you guys, enough people tell me there's interest, we'll put on another one.
Anyone have any other questions?
Well, I just want to make one comment about the ozone water and how I like to use it. When I'm doing surgery, I like fresh ozone water because the half-life of ozone water is about 7.5 minutes. So it's got to be fresh, and you've got to literally have it bubbling. I have it bubbling all day long. So that's kind of one little forewarning about that. So that's got to be fresh. So when in a surgical situation, or I use it for decay as well. I'll irrigate it first to get all the debris out, then I'll gas it. The concentration of gas is about 50 gamma. And if I'm really close and deep to the nerve, I'll go ahead and keep on gassing it until the dentin looks like a little bit of chalky white. At which point, then I think we're good to go. Just go ahead and seal it up and we're done. I hope that helps.
Do you remember the name of I know there's a Jerome mercury vapor sniffer, but what's ours?
Oh, geez.
We called it Ghostbusters.
No,
it's something scientific.
American Scientific?
Maybe. I don't remember, but I know it's we pay a lot of money for that sucker.
Yeah, and I'm looking up here somebody had emailed a question. Now our vapor is not a Jerome, although I'm putting that on here. The other piece of equipment that's the Snuffleupagus is by dentairbag.com. So I'm going to put that on here. And yeah, I don't remember what our mercury sniffer is. I'd have to ask James Wright because he has it. Wow, only 30 minutes and nobody has any questions. You guys are geniuses already.
It's amazing.
You don't have questions about different kinds of filling materials and what has BPA, or how you get away from not taking insurance?
I'd love to know that, how to get away from not taking any insurances. I'm still in network with 5 of them, and I struggle so much because of that.
Well, I made the transition years and years ago. I was an HMO dentist. Okay, I treated every kind of insurance in the freaking country. And as my fees kept on getting cut more and more and more, I kind of saw the writing on the wall. And so what I did was I chose the worst plan first. And when you're under contract, the contract is designed so you lose patients. So in other words, when you sign your contract, your patients have already signed their contract with their employer. So what I did is I sent out a letter about 6 months prior to or 3 months prior to their sign up, 6 months prior to my sign up. And the letter was saying, please look for a better insurance. And I would name a few of them. I went from the HMOs to the PPOs, and I would name which ones I would, thought was a better idea. And then when my contract was up, didn't renew it. And I did that time and time and time again until I was left with basically no insurance. Because it was the worst one, the worst one, the worst one, the worst PPO, little by little. I did not go cold turkey. Some people go cold turkey, and I don't know how you can do it that way. So you got to do it nice and slow, gentle. Does that help?
Yes, thank you. I dropped 7 of them. I still have 5 of them to drop, and that's the scary part.
Well, the
last couple of them.
The other thing that I did was at least in Florida, you can develop what's called a prepaid dental program. It is not dental insurance. A prepaid dental program means you pay me for 2 cleanings and I'll give you a discount on XYZ. So it's kind of like an insurance, but not really. And so for those patients who had that challenge, I would offer them that plan. And I eventually got rid of that plan too, though, little by little.
I don't know if I'm muted or not. Can you hear me?
Yeah, we hear you.
Of course, I don't take any insurance for anything that I do, but it's not dental work. But I oftentimes will have a conversation with people, and I use Toby as an example because many years ago when he went in to have a biopsy on his arm, when he went in that morning, I said, please don't have a scratch biopsy done. Make sure that they do a punch or a wide excision. And of course, when the dermatologist came in, that's exactly what they wanted to do, was a scratch biopsy because that's what the insurance paid better on. So you have to educate the patients that your insurance does not care about your health. They just don't care what is best care. So you have to be educated as a patient to know what your rights are, because the law in Texas, at least, is that there's informed consent, which means you give the patient the options and they choose. But oftentimes when there's insurance involved, bad choices get made just for financial reasons. So I don't know if that's helpful or not.
I still take some insurance and PPOs, but they know I'm over usual and customary, and I never file cavitations. So, and some things I just don't file, they just pay. I just tell them it's not covered. So
We are out of network for everything. We will accept assignment of benefits if, if it's our old existing patients, but as of the beginning of last year, we stopped accepting like new patients insurance. So just the new patients, they pay us, insurance reimburses them. We'll still file for them as a courtesy, but we no longer play that game. We will continue to do that and honor it for our patients that existed until January 1st of last year. But just moving forward from there, that's what we did. And that actually would be the better solution for you, Cammie, I think, is for you to just, every new patient that called, you just, you don't accept insurance anymore. And, you'll build that up, that group up of people, and then as you build up those new people where you don't accept insurance, then at that point, you can drop the ones where, you're having to deal with the insurance. Just, moving forward, you're like, all right, stay forward. We no longer accept insurance for the new patients that call on the phone. So as you get those new patients in the door, you're not accepting their insurance anymore. And then that way, eventually the other ones just, you lose, by attrition. Eventually you're like, okay, I'm just done. I'm not taking that insurance anymore. And that works too.
Do you know if I have to announce or let the insurance know that I no longer accept new patients with them? It might be something that I have to
check your contract with them.
Check your contract.
Okay. I'll definitely do that. Thank you. I had another question about kids that you start the Vivos appliance for them. Do you do the cone beam CT scan to be able to evaluate airway in kids? Because you can start kids as early as 3 years old.
Joan, do you do Vivos or
No.
Ted?
No. I do evaluate them at a very young age, but I do a clinical exam. If I see giant tonsils, I know they're not breathing. And I tell them that parents, you got to clean up the diet, or you got to think about removing the tonsils. I usually try to be gentle about that. Sometimes they don't want to hear that they want to have to become gluten-free and dairy-free. But that's generally where we start. And I'll just ask the whole typical symptoms as to what, how's the child's behavior, do they pee in bed, sleeping at night, things along those lines. And, sometimes parents are receptive, sometimes they're not.
I'm going to ask, I see that Mary Lynn, weren't you here this weekend? Mary Lynn just sent a post. And so we've got somebody on here, Dr. Collins, and I'm going to make him talk. If I can, there you go. Dr. Collins, unmute yourself and tell everybody what you witnessed this weekend with the use of ozone. She's saying that she would like a hygienist to see how powerful the ozone is and the phase contrast microscope. So what did you witness this weekend? I know he's on board because I see him there, but you have to unmute yourself because we can't hear you.
He can't talk.
Yeah, he's on there, but I don't know how to unmute
He
him.
says he can't talk.
He can't talk. Okay. Oh, I see that.
I don't have a microphone. You may not need one.
No, you can do it through your computer. Okay. Well, anyway, well, let me try to share it then. We took a slide and looked at it on the microscope, and there were a lot of trichomonads in this particular case. And then there we found, oh my gosh, a ton of spirochetes. And we ozonated just around the area that we found, just where we took that sample. And we just did it for maybe a minute or two. And then immediately went to the microscope again, and there was nothing other than red blood cells and white blood cells. Everything else was gone. So it is very powerful. And I see that, one person has responded that Eric came out to their office. I think Eric is really good for teaching the doctors. I don't know how valuable it is for the rest of the staff.
It's so valuable.
I think that the class that Mercedes and I do is maybe better for the staff, because we really do focus more on how to make the ozone and how to use it, like for a hygienist. So I hope that answers that question.
Is there any way that there's like virtual learning for the ozone classes?
Interestingly, this last weekend, we just tried live streaming for the very first time. So that's a great opportunity for us to do and then put it online. So you betcha we could do that.
Ooh, I'd be interested.
There's Candida.
Oh, hi. I thought it was mute. I just got I just received my ozone machine. I haven't put it together yet, but everybody's so excited here, so I can't wait to use it.
That's great.
Once you get it going, you won't be able to live without
Yeah.
it. You'll be doing all kinds of stuff with it. It'll even clean your carpets.
I use it for everything.
And you're probably going to get a second one in case the first one breaks.
Or third or fourth.
I had a non-believer in office when we started using ozone, and she came in with ear ache one day. I said, try it. It's not going to hurt. If it helps. If it doesn't, it doesn't. Of course, by the end of the day, she had no pain. Definitely a believer after that.
Or that's great. One of the best things is root sensitivity. That's a great seller on the ozone, because it'll get rid of root sensitivity.
How do you charge for the procedure? Or is it just, you just do it?
I don't charge to do it in the fillings, before the fillings are in surgery.
Okay.
If I'm going to inject like someone who has an infection or something, I charge for that, or the lymph nodes, or if I do in the ears or in the nasally, I charge for that. So I'll charge, I don't even know what they charge, 125 for, and I could do a nasal session or ear session.
Do you learn that? You learn that in the course?
Well, you learn how to do it in the course. You don't learn how to charge in the course.
Yeah.
Yeah, so if you're doing it in the mouth, so if it was a canker sore, for instance, could you use it on that, or a cold sore?
Yes.
Yeah.
Okay. So then, I'm a pediatric practice, unfortunately, accept like too many insurances. So what dental code would you try to, obviously insurance probably isn't going to cover it, right?
It's not going to cover it, so make up your own
like
code.
a palliative
There
care.
actually is a code in the ADA manual for ozone. Now, I don't know what it really says. I never paid much attention to it, but I know it's there. So that gives it some certain validity. But I never use it anyway.
No, I know. Okay.
Ted and Joan, there's a question on here, and I don't know what you can see and what you can't see. So the question on here is, what do you guys do for mercury detox? as prepping for amalgam removal.
Oh, someone's got. I will give afterwards. We do the charcoal before and after the procedure, and then I give them 3 days worth of the lipospheric tea.
Okay, I hear somebody's baby. That's okay. What I do is I like to prepare them ahead of time with sometimes charcoal ahead of time. I don't like it during my procedure. I like to get them to IV vitamin C 25 grams after the procedure. I don't do that for many more days than that, but I do like the liposomal C immediately after the in-office procedure.
I have a question.
Yes.
Ted, can you talk a little bit more about the vitamin C and how do you handle that in amalgam and in other cases? It's a lot of buzz about the vitamin C, but I guess I'm not too familiar with it. I haven't used it, at least here. But
all right, now ideally, you'd like vitamin C to be delivered intravenously. And the only reason for that is you get high doses of it. I like 25 grams to start with. Now, the liposomal vitamin C can approach that level, but not quite. You know what I'm talking about with liposomal vitamin C?
No.
Okay. Regular vitamin C is ascorbic acid, and it's usually a powder. Okay. If you take more than maybe 8 of those pills, you'll be running to the bathroom. Or maybe 10 if you're lucky. With the liposomal, you can get up to around 15, but then you start running to the bathroom. Intravenously, you can induce, well, actually, I always start with 25 grams. I don't do it in my office because in Florida, we got problems with that. I have to send them out to another place to have it done. I like to start them off with 25 grams, and if they're a very unhealthy patient, I will ramp them up to 50 grams, sometimes even higher than that. But I like the 25 grams is a good starting place. Depending on what their symptoms are. Now, I have to differentiate between treating them for the dental procedure and treating them for their entire systemic health. If I start treating a patient for their entire systemic health, I've just violated what I should be doing as a dentist. So that's where I like to work with my functional physicians who help augment everything I do. So that's kind of where I draw that line. Does that help? Does that answer your question?
It does. It does.
Okay.
And Candida, I don't remember what state you're in, but here in Texas, it's a very gray area. Having served on the board, I contacted the board to see, what they felt about it. They couldn't see a reason why vitamin C would be used by IV in a dental office. And you need to be very aware of people who have G6PD, which just means that that's a condition where the red blood cells kind of explode under certain circumstances, and vitamin C by IV could be one of them. And that wouldn't be an issue with the liposomal, but it would be with IV. So you just always want to be safe.
Well, with the G6PD, it is also an ethnic thing. And so if you're dark skinned, you're more likely to have it. So it's a very small percentage, less than 6%.
Yeah, African Americans and Mediterranean descent are probably the highest. But every once in a while, you find somebody like me.
You haven't?
No.
Oh.
I mean, every once in a while, you will find someone who's fair complected.
Yeah, Melissa said she's found it. She's had it happen. I send to Melissa too, so.
Thank you. Thank you for the information. Very helpful.
If you guys come to the Blanche is going to put on another class. We're shooting for some time in July, and this last one that we did, I don't know who all was there. Karen, I think you were there. We mixed up bags of IV vitamin C just to show you how to do it.
It was a great class too.
Yeah, the next one's going to be really good too. I mean, I think she's going to do a 3-day and be much more involved than what there was before. So that should be good. Okay, wow, we're at 48 minutes, which is pretty good for us. If nobody has any questions, it's not like I'm gonna drag you all through this. We'll save the recording and you can go back and listen to it. And I think what would be nice is if Ted and Joan would each share their email contacts. My hope is that by seeing faces, you will see us as more approachable and you'll not have a problem emailing any of us. Somebody raised their hand. What does that mean?
They have a question.
That is so weird. I've never, okay, so Milad, I don't know how to make you unraise your hand. So
How do you raise your hand? I can't even see that.
I think it's because I'm the moderator and I see it on here. So is there something that you want to say? Because I don't see how that's showing up.
I have a question.
Okay.
So glass ionomers, does that no glass ionomer use, or because in pediatric dentistry, minimal invasive dentistry where is being used. So we try to do things to prevent needing like sedation or general anesthesia. So glass ionomers are used a lot, especially in the young kids. So is there a take on glass ionomer use?
I use it sometimes when you have to, you know. I mean, I think it's definitely better than mercury. Do you do air abrasion too?
No. I mean,
that's great for kids.
Yeah.
So is laser.
Ozone, yeah, I do ozone and air abrasion on kids all the time. I don't have to anesthetize them. It's great. We go to the beach.
Yeah, we use it a lot. Well, I use it a lot, say, on a 2-year-old that we're trying to stop the decay until they can mature for more definitive treatment, or we've saved a lot of kids from needing sedation or general anesthesia doing with the glass ionomer technique. Well, I guess you guys use silver nitrate instead of SDF, right?
I use ozone. Ozone.
I don't use the silver nitrate.
What was that?
I do not use the silver nitrate. I will use.
I don't either.
I will use ozone oil. I will gas the tooth. I will, suggest to the parent that they change their diet. But I won't use.
Of course.
Yeah, I would do ozone and yeah, if you need to use glass ionomer.
How long do you apply the ozone for? I guess I have to take the class to learn more about it.
When they're in office, again, when they're really small, you really can't do it too much.
Yeah.
You kind of debride the area a little bit, try to get all the schmutz off of it, and wash it if you can, but sometimes they won't stay still for that. But you just gas it. I use basically one, maybe if I'm lucky, I can get 2 syringes into a carious lesion. Yeah.
And those big 12 cc syringes I use.
Yeah, that's what I use too.
Yeah, with the little tip from the etch.
I use the flowable tip, yeah.
The little etching tip, and put that in there and have the suction right there so I don't breathe it. I mean, we just have the small one there, the saliva ejector. And sometimes I'll have them close and then do it so they don't inhale it at all. Because if they inhale it, they're going to feel like they're hacking a lung out.
Yeah, and
that's when you give them vitamin C right then. I keep the chewables actually for the kids, the chewable vitamin C for the kids on hand in case that happens. Every once in a while they'll go, if they're upset and they inhale it and you're like, ugh. They start coughing and coughing. But that's why you keep the suction there, and I'll have them keep closing every once in a while because they like to do that, usually. They like to close on the saliva ejector so that they're not inhaling any of it that's left in the mouth.
I have, let's see, I've got 4 ozone machines. I've got 1 longevity, and then I have 2 for the hygiene, for each of it, 1 for each of the hygienists, and then I have a 4th one that goes from room to room with me. The last 3 I got from Eric in his class because they were much more affordable than the longevity, which is it's very expensive. So I just have a small tank of oxygen. I've got my the ozone generator that Eric sold me, and I just hook it up to that. I hook one of those little tips up to it, and I have the high speed suction right there. But then that way I don't have to like go back and forth with a syringe, which is what I had to do before I took Eric's class. And that makes things really, really nice because I can sit there for as long or as little as I want to, you know, depending on what I'm treating, you know, as far as that goes. So it's really, really nice to have it like that. And it's not terribly expensive from him either. So
Just make sure they don't inhale it. I have problems with them inhaling it that way. So,
really? We've
yeah.
not really had any problems. We just have I don't use it though on really littles. Like I don't.
Yeah,
use
I
it
do. I've used it on
little.
teeny. Yeah. So I think the syringes are safer with the tiny ones.
Yeah, with the
Even
really littles.
5-year-olds. Because
Yeah.
sometimes they just take a breath in, you know.
Yeah. But we've done pretty well with it that way, and we have the high volume suction right there, and they're okay.
I have one more question, please. So
Yes?
I'm doing a lot of, I don't have a pediatric office, but I see some patients. And there's, in the past few months, there has been few mothers come, and these are little 3-4-year-old coming, and they have almost like a baby cavity decay. And the mother swears that there's no milk involved, that their diet is completely organic, and I don't know what else to say. So how do you approach? I mean, there's no fluoride that they use. They don't use in the house. Supposedly there's no sugar. So how do you treat? Like, what do you recommend? Because I don't know what, you know, besides keeping them clean, make sure they floss, no juice. How can you give me some idea how do I approach these cases?
They need to eat butter. I tell them they need to eat butter, and I use the Shine tooth powder that's hydroxyapatite, nanonides hydroxyapatite to rebuild the teeth. It comes in cinnamon and it comes in mint.
And you get it from Henry Schein, you said?
No, it's called Shine, like sunshine. It's from Aura Wellness. ORAWELLNESS.
Okay, thank you.
And they could rub a paste. They can brush with it and not rinse, or they can rub a paste on it at night and put it on there. It's one of the cleanest things I found.
Okay.
Can I just chime in just about the diet part? There's something else, even if they're trying to eat super healthy, even organic crackers, there's organic suckers, there's organic
sugar.
Yeah.
There is something sticking in there. The parent will try not to, but if you say with confidence there is something, and they'll be like, oh, well, they do go to grandma's. There's something going on. I mean, unless there's a defect in the tooth, but just to let you probably just don't realize it.
Well, the other thing that I would suggest is you look at gluten and dairy as some of the other sources of trouble. All right. And I've had parents come in and say, well, they're still nursing. And I said, well, fine, but are you eating gluten or dairy? So the child's going to get it through mom.
I will tell you honestly that the vast majority of the kids that I see with decay have ties. They're tethered oral tissues that have the decay. The ones that have decay have tethered oral tissues. And so, you know, that's a big, that's one of those things where I made, you know, as I've gotten into this whole airway centered dentistry thing is where I've really noticed the sheer amount of tongue ties that there are out there and lip ties. So what I see is when I see children with decay on their upper anteriors, almost always they have a lip tie. When I see them with decay on the primary molars, almost always they have a tongue tie. So that's just been something that I've noticed that has really startled me over the last year and a half. I did not realize. And then obviously gut health matters,
Right.
Because decay is more about gut health than anything else. So if you've got a kid whose gut health isn't great because they've been on antibiotics, You know, but a lot of times the crunchy granola ones are not on antibiotics. They've never been on antibiotics, and yet they still don't have great gut health for some reason. Something has them off.
Teresa.
Often it's mouth breathing. You know, mouth breathing will throw off your microbiome in your mouth and in your gut.
I don't want to cut you short, but our meeting is about to end because we have an hour and it's 7:59 and I think it cuts us off. So I'm hoping that we're going to do this next month and you will tell all your friends and we can grow this and you guys can come to the meeting with questions next month. We will have at least one different speaker, maybe two. And so we'll see. But hopefully you guys can give me some feedback and put it out on Facebook how this was helpful, okay?
Sounds good.
Thank you, Dawn.
Thank you.
Thank you.
Bye, guys.
Bye-bye.
Okay, and I got to figure out how to hit end meeting.
Are you in recording?
Thank you so much, everybody.
Thank you. You're welcome.
Once I hit the end, then it should save it and record it. Okay, bye.
Bye, guys.
Bye.
Bye.
And I'm
Bye.
still you, Dawn.
Yeah. Goodbye, Don.
Okay,
Both Dawns.
end meeting for all.